COVID-19 pandemic has caused great economic hardships for many. What do you need to know so that you can save money, especially in relation to healthcare costs and medication? Well, we have some ideas for you and suggestions about generic drugs and how they can help save money. Let's take a look.
Are you ready to start?
I am.
Okay, perfect. Generic drugs can be lifesavers for people in need of medicine. They cost less than the name brand drugs, but are just as effective and are FDA approved, and insurance plans tend to steer patients to them for that reason. Joining us to discuss why the need for generic drugs has never been more important is the president and CEO of the Association for Accessible Medicines, Dan Leonard. Thanks for talking with us, Dan.
Thank you, Christine. Pleasure to be here.
So why are generic drugs so important, and how frequently are they prescribed?
Well, they're as important as ever right now because of the economic situation we are in as a country and as individuals. Economic strain all around, healthcare costs that have been continually rising. The one exception to that on the healthcare side is when a branded medication is opened up to generic competition. That's when you see significant savings. So the amount of drugs being prescribed in 2019. 90% of those medications were generic. So 90% of the prescriptions filled for generic, but only 20% of the overall cost of drugs in that system. So that's a significant number. That led to $313 billion in overall savings for taxpayers last year alone.
And you mentioned there are really big savings benefits of generic drugs. Are there other financial benefits to American patients?
Yeah, significant ones. So I mentioned these kind of big macro numbers around the savings for the system, but at the individual level, it's even more concise and probably appreciated when you walk up to the pharmacy counter and you have a new prescription for a brand medication. The average copay for that branded drug is around $60. For generic medications, the average copay that a patient would have to pay out of pocket is about $6. So there's a 90% reduction right there, and that's right out of your pocketbook or out of your wallet. So that's a very significant improvement and savings for patients.
And how are generic drugs being used to treat COVID-positive patients and save lives?
So since the beginning of the pandemic, as individuals have gotten ill and had to go to the hospital, our frontline healthcare workers have had to treat those patients, and they're using the tools available to them, and many of them are generic medications, reliable medications that have been around and approved, but also very affordable, from muscle relaxants and sedatives that you have to give patients before they receive a ventilator, to steroids that help reduce lung inflammation and help correct oxygen levels in a patient. So those are all generic medications, and until we have a vaccine that everybody can take, and we're all looking forward to that day when a vaccine is available. But until that day, it's going to be generic medications that are the bridge to get us to the vaccine.
And how much healthcare system savings can be attributed to generic drugs?
So I mentioned some of those large savings, $313 billion, but if you break that down into our significant government health programs like Medicare, Medicare saved almost $100 billion last year through the use of generic medications. Medicaid saved almost $50 billion last year through the use of generic medications. So you have significant system-wide savings as well as savings for the individual patient. Myself, I used to be on a branded drug known as Lipitor to help lower my cholesterol. It was a pretty expensive component of my overall healthcare budget. I'm now on a generic medication called atorvastatin. Millions of people are on the same drug. It's pennies. 95% cheaper than the original Lipitor that I used to have to take. So that's significant.
That really is. Where can we get more information?
So lots of information on the studies that I just cited, as well as work that our companies are doing around COVID-19 patient care, can be accessed on our website, accessiblemeds.org.
Well, thank you so much, Dan Leonard, for joining us today and informing us about the importance of these generic drugs and the savings that they attribute to us.
Excellent. Thank you very much.